seriously. If we all buy into this, people stay at home, if people, apart from the things which are like work, going out for essential shopping, exercise, if people stick to those rules really strongly, and at the same time, the NHS is vaccinating as fast as it can, then our hope is the lockdown will be enough. But we've all got to do that. This has very much got to be a collective effort. No one can do this on their own. You can't just do it by rules. It's got to be people buying into this really seriously. In terms of longer term things, obviously what we all hope is that we can get a vaccine program that actually means we don't need anything in the future at any stage. That would be the ideal. But I think it's also important to understand that this coronavirus is not going to go away just as flu doesn't go away, just as many other viruses don't go away. And the time that benefits them most is always winter. That's one of the reasons we're having problems now, along with the new variant. And therefore, we just need to keep an open mind about that. The hope would be we don't need to do anything, certainly nothing on the scale we're having to do at the moment, because vaccination should take the great majority, possibly all, of the heavy lifting. But I think what we shouldn't kid ourselves is it just disappears with spring. What will happen with spring is the risks go right down. Hopefully we'll have spring, summer and autumn, possibly winter as well, with almost nothing in place once the full vaccination programme is through. But we just need to be aware of the fact this is not a problem that just disappears.
Thanks very much, Jason. Let's go to Andy Woodcock, Independent.
Prime Minister, we understand that the UK is shortly going to introduce mandatory negative coronavirus tests for foreign nationals flying to the country. Tests are something that airports have been asking for months. They've been used successfully in other countries for a very long time now. Why has it taken so long for Britain to adopt this position? Is that something that has contributed towards coronavirus being so persistent here in the UK? And if that's what we're requesting from foreign nationals, why not UK nationals coming from abroad too? And also, if I could ask the scientists, the Prime Minister has described schools as a potential vector for coronavirus. If that's the case, why is it that teachers and pupils are not on the priority list for vaccination? If we vaccinated them, is that not something which would allow us to open schools sooner?
Well, thanks, Andy. First of all, I'll ask Chris and Patrick to answer about transmission in schools. I just repeat that schools are safe. But on what we're doing to protect the UK from transmission from abroad, we will be bringing in measures to ensure that we test people coming into this country and prevent the virus from being readmitted. But Patrick or Chris, you want to add anything on that?
I mean, on school, but two points on this. The first thing is just to reiterate a point the Prime Minister made. One thing that we do not think is that this new variant is any more dangerous for children than the old variant is. And there's no evidence, for example, that the hospitals are filling up with children. There is always a risk with any infection to people of all ages, but children are relatively much less affected than other areas, than other groups, which is one of the few good things you can say about coronavirus. And that will be important when, obviously, when schools can go back. In terms of vaccination priority, I think from a clinical point of view, the real priority is to make sure that we know who the people are who are by far the most likely to die and are by far the most likely to end up in hospital. And it's that ordering which the Joint Committee on Vaccination and Immunisation, JCVI, has put in place, and which everybody who's looked at this has agreed this is correct ordering. Lots of academics, lots of others have looked at it, and they all agree. So I think it's very important that that ordering, which takes us down not just to the first 4 tiers, which the Prime Minister talked about, but all the way down to people who are in their 50s, which would include some teachers, obviously, and people who've got underlying health conditions, is followed through, because those are the people who are the most likely to come at risk. Then that still leaves around half of the, well, slightly more than actually, than half of the population, and there will have to be some decisions made about that in due course, but we are some way from that, and I think the key thing is prioritise those who are most likely to come to clinical harm. A final point on the vaccine is neither of the vaccines are currently licensed for use in children, so we would not be going down that path at this stage, but that may obviously change over time. Patrick, do you want to add to that?
Nothing to add. Terrific. Thanks, Andy. Let's go to Dominic Yateman of Metro.
Hi there, Prime Minister. The UK has seen more than 50,000 people test positive for coronavirus for 8 days in a row now. If you had taken this lockdown decision 24 hours earlier, it would have stopped 3 million primary school children mixing for a day and taking a new wave of infection back to their families. Do you regret this delay? And secondly, if I may, nearly 1 million children access the internet via mobile phone connections, where a day's lessons can cost £100 on pay-as-you-go. You still insist that schools are safe. Shouldn't those children be in school? And if not, why are telecom companies allowed to charge for access to school and educational websites still?
Yeah, well, I mean, in a way, Andy, I think you've, sorry, Dominic, you've answered, forgive me, you've answered your question about why did we want to keep schools open. It's just such an imperative for any country and any society. And as I said, I think to Vicky from the BBC, we wanted to do everything we could to make that possible. Alas, on yesterday, it became clear that the data simply wasn't going to support that, and the risk was that the tiering system, the tier 4 system, without taking schools out of the equation, was just not going to be enough on its own. We couldn't take that risk, and although we're now seeing some signs that maybe tier 4 is starting to work in London and maybe a bit in the southeast on the new variant, the spread of the new variant was really very, very troubling indeed. And so that's why we took the action that we did. We don't want to do it. We want to support kids in school if we possibly can. I'm glad that the BBC is as I say, putting a lot of educational stuff on TV. That is fantastic. We are also looking at the very point that you make about the potential cost to parents of online teaching, and we're going to do our best to support them in any way that we can, and to work with the internet companies to see what we can do to help, because this unquestionably will be a tough period. And all I can say is what we want to do is get back to a position as fast as possible where we can get kids back in school, and that's why we're doing all the things that we're doing now. Thanks very much, everybody. I appreciate that this is a very, very tough final stretch for this country. It's been made tougher by the new variant, much tougher, alas, by the new variant. But the jabs are going in to people's arms day by day. We'll keep you updated on what is going on. And in the meantime, I must repeat the basic message. What we've got to do is to stay at home, protect the NHS, and save lives. Thanks, everybody.